Pharmacy Times. Everything pharmacy, every day.
I got pneumonia, and I had never been that sick before in my entire life. And I'm a very healthy person, but it pretty much uh, took me out of the picture. I had a terrible cough that basically was hurting my chest. I had high fever. Once I just was not getting any better. After a couple of days, that's when I went to the hospital, and that's when I was diagnosed. And I think about people who have other chronic diseases like cancer, diabetes, and other things that would affect their immune system, who might not be able to fight it off, as I was able to do. This was prior to the vaccine being given to people under 50. Now, of course, we know that it's been lowered by the ACIP. And so that's a good thing because in Black and Brown and Asian communities where the vaccination rates are low and where there are higher rates for pneumonia in those communities, it's a good news that they've lowered the age to 50 because when we're seeing more people who get pneumonia. So we're very happy about where this has gone in the last month, I guess now. In my organization, we advocate for older adults, and we certainly have an emphasis on older adults of color who have not had the access to quality health care and aren't as aware of things like the vaccine that are important to their health. And so we got involved in it as part of what we do in not only maintaining health and wellness, but working in preventive measures. And this is a big preventive measure for something we know affects our communities more than in others. And so that's why we got involved in it. And because I can personally speak to how difficult not only getting pneumonia and going through that process, but how long it took me to really get back to myself. I couldn't work for a month. I couldn't eat or drink. I had a excruciating cough and again, chest pains as a result. And after I got over the initial part of the pneumonia, again, I wasn't vaccinated at the time. It took me at least 2 more months to feel normal, to stop with the fatigue and stop with the cough. I don't want anybody else to have to go through that. So that's why we have partnered with other aging and patient advocate groups to get the information out to our communities who may not still be aware that the age has been lowered to 50 and older now to receive the pneumococcal vaccine. Black, Brown, and Asian communities have a lower rate of vaccinations. And in particularly now with so many vaccines that are being talked about, this is one that's very important because of the decision that was made in October by the ACIP, and I guess I should say you'll have it out, but the Advisory Committee on Immunization Practices, when they made the decision to lower it, they recognized that because rates were low and the disease was higher in people who from that age on, reducing it from 65 down to 50 was significant for our communities. And again, it's because of lack of access to healthcare, health disparities, all of the other things that we hear about that communities who are poor and communities of color that are impacted more by these kinds of diseases. And so that's why it's important that we get the message out. So there's one more way of protecting themselves and preventing something that could be deadly for them. So that's why we got involved, and that's why we are promoting this information. For communities of color, for older adults of color, uh, chronic disease management is very difficult because they've not had access, and we know again about all of the health disparities that come that have go before these communities. And so it's just extremely important that we at least try to get as much information out uh, that people may not be aware that at one time this was only for people 60, recommended for people 65 and older. And now, with lowering it down to 50, you'll be able to capture more people who have access to it who could get pneumonia like I did. I was younger than 65 at the time. And so I was not able or eligible for the thing, but I was, younger. And now, as I became eligible, uh, I could get the vaccine. And I just want to make sure that people who are at least 50 and older, and certainly through the advice of their health provider, that they can prevent getting as sick as I never want to be again. I just think that it's important, particularly during this respiratory season, to take advantage of how they can care for their own health, be advocates for their own health. And the way they do that is to learn more about how you can get these vaccines to protect yourself, to keep you healthy, and to certainly make sure that, you know, that they stay healthy and that they don't get as sick as I've got. We can prevent that. I just wouldn't wish pneumonia on anybody. It's a horrible thing. And the death rates, 1 out of 20, you're 150,000 people a year contract pneumonia, and 1 in 20 of those dies from it. If we can avoid those sicknesses, and if we can avoid people getting that sick and then even death, this is why we promote it and hope that people will take advantage now that are 50 and older to get this vaccine.